And shifting our focus for now. Ladies and gentlemen, we are choking. Even as I am reading this bulletin, I have been choking quite a bit. But every winter, Delhi's toxic air is forcing more children into hospitals. And it's starting even before they are born. That's right, ladies and gentlemen. The trouble isn't just about our children gasping to breathe. Instead, it's about the unborn fetus in the womb. Doctors are finding the damage actually begins in the womb. Across Delhi-NCR, more newborns are arriving with immature lungs, needing longer NICU care. And more infants are developing pneumonia within weeks of birth. And it is increasingly being found that it has a direct connect to the pollution. Experts say families can only do so much with purifiers, masks, and limited exposure. The real change must come from cleaner fuels, stricter emission controls, and better monitoring. Doctors are calling this what it is, a neonatal health crisis unfolding in India's most polluted cities. And I'm being joined by Dr. Ravi Malik, CMD for Radix Hospitals. Thank you very much, Dr. Ravi Malik, for joining us. You know, even as we talk, this is a time when so many children, much higher in number than even last year, are being taken into hospitals, into NICUs. But we are taking our focus away from not just children for that matter. We're talking about fetuses, we're talking about newborn children. How crucial really is this challenge at this point?
First of all, I will thank you on this program because it is a very crucial issue and we pediatricians are really suffering because of the pollution, not only for our health, but for the health of the newborns and the pediatric patients also. Because what happens is when a baby is born, the baby is born with low immunity, number one. Number two, the lungs are, of course, weak. Number three, the airways are very small. So now taking these three factors into account, if pollution also comes over it, then it is very damaging for the lungs. So what happens is when the pollutants, they go in the delicate airways of the baby, they destroy the delicate airways, cause the inflammation over there, and they also cause destruction in the lungs of the baby. So what happens is that it becomes a fertile ground where the bacteria and viruses, they can grow and they can cause pneumonia. Pneumonia per se will not be caused because of pollution, but pollution will aid to cause pneumonia. And pneumonia is caused by the infective agents like viruses, like influenza, para-influenza, respiratory syncytial viruses,
right.
And it is also caused by various bacteria. So pollution is a very important factor which is causing pneumonia in the neonatal period.
No, so Dr. Ravi, break this down for us. How are you saying that cases are increasing? Like when you look at the cases around you, how serious is it in terms of numbers? Can you break this down for us? In the sense, is it 5 times more than what it was last year? We're talking about a very sensitive case because as parents, we really don't have much of an option. You have to have your children around you. You have to have children in Delhi-NCR area and other polluted cities of India for that matter. It's staring right at us. So are you then saying the cases, you know, taking nebulizers for that matter or taking the nasal drops is just the new normal and parents have to come to terms with it and so do small children?
Yeah, it is. Our OPDs are filled up with the pediatric patients who are suffering from asthma, which is now precipitated because of pollution and with other kind of allergic problems, allergic rhinitis, allergic bronchitis or pneumonias. And the neonates are also particularly suffering for this. So the incidence is significantly increased because of the pollution. And I must tell you one thing, the patients who are having repeated attacks of cough, wheezing, if they shift the place, they go abroad or they shift to a place like any state where pollution is low, these children are immediately cured for that matter. So pollution, we are staying in a gas chamber. We are smoking almost 10 to 15 cigarettes every day. And it has got a very bad impact on the lungs, on the delicate lungs of the pediatric patients, especially those who are less than 5 years old. And the incidence of pneumonia and allergies has drastically increased. There is no doubt about it.
All right. Dr. Ravi, my last question to you at this stage. what must parents do? You know, one is what must children do? You obviously have their sport periods, for that matter, now being made into afternoon, and schools are trying to do what they can. There are air filters in schools. But what can parents do? What must they do, particularly pregnant women, as well as parents to, small toddlers or infants?
Now, to protect yourself from the pollution, we should do few of the exercises. Number one is that we should not smoke at home. We should not put on agarbattis or mosquito coils. They cause more pollution. Second thing is we can use N95 mask, which is very protective for the from the pollutants. Then we can use air purifiers. We can have indoor plants. We should have plants all over the colony. That is also going to help in the decreasing the effect of the pollution on the body. And the delicate children, pregnant females, and the newborns also, they should not be taken outside, especially during the period when smog is there and the pollution is much more during
Dr.
the
Ravi?
late evenings. They should be protected for that matter.
Dr. Ravi, I don't even know how to respond to you, because what does it even mean that children must not be taken out during smog times? They're going to school. Children, in their across ages are going to school during smog times. They are going for tuitions, even if you have it online. You still have schools really functioning in NCR with the physical presence as well. So, I mean, practically speaking, then you're really saying we are left with nothing but air filters to make the best resort of it, is it?
But I must also tell you that it is a medical emergency. We should also, studies are of course very important, but we have to protect the delicate lungs of the child also. That is also very important.
Absolutely.
So many schools are doing online classes now, and I think it is a medical emergency. And whatsoever protection we can provide to the children, we should provide. Of course, it is very important to go to the school. Maybe they will go to school and come back, and they will not go for the parties and other outings, which can be avoided for that matter.
Dr. Ravi, this is a very, very tight rope. Thank you for your time. Thank you for joining us, trying to explain all the sensitivities of it. It really is a challenge, and hopefully the government is really watching this. While there's a lot of politics around the pollution, the truth is it's the results of a clean air is quite far from us, and more importantly, far from even unborn fetuses or newborn children for that matter. We're shifting our focus, ladies and gentlemen, for now. The Supreme Court has sought a detailed response from the Delhi government on how the national capital's air quality index is being measured. This comes after reports alleged that water was sprinkled around pollution monitoring stations to distort AQI readings. A bench led by Chief Justice B.R. Gavai has asked the Delhi government to file an affidavit by Wednesday explaining the equipment being used and how efficient these monitors really are. The court took note after amicus curiae, Aprajita Singh submitted media reports claiming water sprinkling near monitoring sites. The centre, however, denied any wrongdoing, calling the videos politically motivated. CJI Gavai remarked that he had personally seen water sprinkling near the Supreme Court as well. The court also discussed stubble burning data, while official figures show a drop from 28,000 to 4,000 cases. The amicus claimed the numbers were being undercounted, a concern also raised by CAQM. She told the court that farmers need better machinery and compensation to avoid burning crop residue, suggesting 100 rupees per quintal support for the centre. Senior advocate Gopal Shankaranarayanan warned that Delhi's pollution is causing an alarming rise in lung cancer and said regulatory bodies like EPC and CAQM have failed to control the crisis. The court then explored whether year-long bans on stone crushers and heavy construction machinery were possible, but the centre said such curbs would harm essential economic activity. The bench agreed it cannot impose blanket bans, stressing that lakhs depend on these activities for livelihoods. It called for coordinated action from the centre and the governments of Punjab and Haryana, Uttar Pradesh as well as Rajasthan. The matter will now be heard on November 19th.